Hello friends, welcome to Kavita Medicos Education, and this is part 2 of lung cancer. So before going to start with the pathophysiology of lung cancer, if you guys have not subscribed to my channel, so I request you please like, share, subscribe for more new videos. So let's start with the pathophysiology of lung cancer. So whatever causes we have read about the lung cancer in part 1 of this video, like due to etiological factors. So whatever causes and risk factor are for lung cancer, like smoking, like cigarette smoking, asbestos, radon exposure, and genetical factor and air pollution factor. Okay, so whatever causes are for lung cancer. So due to these causes, what will happen? There will be two things will happen in our body. First, we will discuss this part. Okay, so if the person is doing a continuous cigarette smoking, then what will happen? Due to the cigarette smoking, the carcinogen which are present in the smoke, it will damage our lung cell. It will damage our normal or healthy cell. Then what will happen? Our immune system or our immune cell will try to repair the damaged cell. Okay, so here body repair them. So when the carcinogen will affect the healthy cell, they will damage the cell. Then what will happen? Our body will try to cope up the situation and our body will repair the damaged cell. Okay, then again if the person is doing smoking for a long duration of time and lot of carcinogens are entering in our body, then what will happen? There is a continuous causes, means the person is not quitting the smoking. Okay, the continuous exposure through the asbestos, radon and carcinogenic factors are coming into our body. Then once a time will come when it will affect our repairing system of body. Okay, once the time will come when it will affect our repairing system, then our body will not do the repairing mechanism. Okay, so this continuous exposure through the carcinogen will affect our repairing system of our body. And then finally what will happen? The normal cell will convert into a tumor cell or into a cancerous cell. Okay, so how a normal or healthy cell get converted into a tumor cell? Okay, so there are mainly two processes which happens. First we have metaplasia. Metaplasia means when a normal cell changes its shape and size. Okay, it converts into another cell. Suppose epithelial lung cells are converted into a squamous type of cell or into a cancerous type of cell. That is called as metaplasia. So here a tumor formation is done. Here tumor or cancer is going to happen in our body through the metaplasia process. So metaplasia means change in cell type. Okay, the cell will change its type. Suppose I have given example of epithelial lung cell will convert into a squamous lung cell. Next we have dysplasia. Dysplasia means there will be abnormal cell division, there will be abnormal cell growth, because cancer cell do not die. Okay, they do not follow the apoptosis process. Okay, so what will happen? There will be tumor or mass or cancer formation will happen in our body. Then this slowly this cancer will do invasion and angiogenesis. Okay, invasion means this cancer or tumor will go into the surrounding lung tissue. Okay, it will spread into the surrounding or deeper lung tissue, that is known as invasion. And angiogenesis means when the cancer forms a new blood vessels for itself, that is known as angiogenesis. So this tumor or cancer cell will develop their own blood vessels. Okay, why they are developing their own blood vessels? For the oxygen and nutrition purpose. Okay, due to which they can grow and divide in a numerical manner. Okay, so they will do an invasion, angiogenesis, and after some time there will be metastasis. Okay, there will be metastasis formed in the lung tissue. Metastasis means there will be spreading of cancer from one area to the other areas of body. It can be local spreading or it can be distant spreading. Local means the cancer is spreading into our lungs only and into the lymphatic system, into the lymph node also. Okay, like pleura, like there is a trachea, bronchi or windpipe. Okay, so it will do a local spreading or it can do a distant spreading. Distant means it can spread to our organs like adrenal gland, kidney, liver, bone and into the brain also. That is known as metastasis. Okay, so we have read this part. One more thing can happen. If suppose our body have repaired the cancerous cell. Okay, now the person is not doing the smoking and our body is in a healthy condition. So what will happen? Our healthy cell do a mechanism that is known as apoptosis. Suppose that repair cell, suppose that damaged cell have repaired, and now this damaged cell is doing its normal function. Okay, it get repaired through our body and it is doing its normal function. Then what will happen? It will do the apoptosis. Apoptosis means normal cycle of our cell, in which cell will get die after doing its function. Okay, the macrophages will eat the cell, that is known as apoptosis process. Okay, so this was the normal cycle of any healthy cell. Other thing which will happen in our body, suppose due to the smoking or genetic factor or any kind of carcinogen exposure will do a genetic mutations into our normal healthy cell. Okay, then the carcinogen will change our cell DNA, that is known as genetic mutation. So here carcinogen is causing a DNA damage. Now when the DNA or genetic material of a healthy cell is damaged, now what will happen? The mutated cell, the change in cell, or the cell have converted its type. Okay, the cell have converted its type, it is in the mutated form now. Now this mutated cell will avoid the apoptosis process. Okay, it will do a uncontrolled cell growth, and again they will form a tumor here, a cancer formation here, and they will do the invasion and angiogenesis to the nearby organs and tissues, and at the last it will go into a metastasis process. So this was the pathophysiology of lung cancer. Next we have clinical manifestation of lung cancer, or we can say that we have sign and symptoms of lung cancer. So first we have persistent cough. So there will be continuous cough will remain in the patient. This cough can be in a dry form or can be in a wet form also. Okay, and this cough can be in a mild form or in a severe or chronic form also. So the patient will have a continuous cough and there can be pus or blood in the cough also. Next symptom we have, that is hemoptysis. It means there will be blood in the sputum. Okay, whenever the patient will do the coughing process and he will spit the sputum out, then there will be a tinct of blood or strikes of blood can be seen in the sputum of patient. So these two symptoms can also be seen in the tuberculosis patient also. Next we have dyspnea. There will be shortness of breathing. Okay, so patient will gasp for the breathing. Why there is difficulty in breathing? Because the tumor cell is suppressing our airways, our bronchi and bronchus. That's why patient will have difficulty in breathing. Next we have wheezing. There will be whistling sound will come out from the patient lungs whenever he will exhale the CO2 out. Why there is whistling sound coming out? Due to the narrow air passage or constricted air passage. Okay, if the tumor cell will suppress our airways, our bronchi and bronchus, then what will happen? The pathway of our airway is become narrow or constricted. So whenever the CO2 will move out or whenever the patient will exhale the CO2 out, then a high pitched whistling sound will come out. Next we have chest pain. So patient will have a chest pain due to the tumor formation or cancer formation in the chest. Okay, this pain can be in a mild form or can be in a severe form also. Next we have hoarseness. Okay, there is a rusky or low pitched voice will come out from the patient. Okay, why there is a hoarseness in the voice? Due to the pressure of tumor in the laryngeal nerve. Okay, if the tumor will press the laryngeal or voice nerve, then patient will have a rusky and he will have a hoarseness in his voice. Okay, there will be low pitched voice. Next we have unexplained weight loss. Okay, so patient will have a severe weight loss. Even patient is not losing his weight. Okay, he is not trying to lose his weight, then also he will have a weight loss problem. Okay, so in a cancer patient, the patient loses his weight in a rapid way. Next we have fatigue, loss of appetite. So there will be fatigueness, there will be weakness and there will be loss of appetite condition can be seen. Why there is fatigue and weakness? Because all the nutrition and all the supplements which you are taking and all the oxygen which you are inhaling, these important nutrition are are taken by the cancer or tumor cell. Okay, so cancer or tumor cell will take all the important nutrition from our body. That's why the patient will have a fatigue and weakness condition. Next we have fever and frequent infection. So patient have a fever condition and there can be frequent infection like bronchitis and pneumonia can be seen. Why there is a fever and frequent infection? Due to the suppress of our immune cells, due to suppress of our lymph node by the cancer or tumor. Okay, next we have bone pain. So these symptoms are seen when the cancer have spread to other part of the body. Okay, so these symptoms means bone pain up to the jaundice symptoms are seen whenever the cancer have spread to other areas of our body. That is called as metastasis process. Okay, so in a severe or in a fourth stage of cancer, we can see these types of symptoms, that these are severe symptoms. First we have bone pain. Why the patient is having a bone pain? If the cancer have spread to the bone region, okay, then patient will have a back pain problem, he will have a hip pain, and he can also have the shoulder pain also. Okay, next we have headache, dizziness and seizure. So headache, nausea, dizziness, seizure, these type of symptoms are seen when the tumor or cancer have spread to our brain. Okay, then we will see these type of symptom in the patient. Okay, there can be fits or seizure, there can be dizziness, weakness, fatigueness. Okay, there can be headache also. Next we have swelling in face and neck. Okay, a swelling or that is called as swelling can be seen in the face and neck of the patient because the tumor have suppressed our superior vena cava. Okay, if the tumor will suppress the superior vena cava, then the patient will have there will be swelling, there will be edema condition can be seen in the upper extremity of the patient like the face, neck and the arms. Okay, if tumor have suppressed the superior vena cava, because superior vena cava brings the venous drainage from the upper body to our heart. Okay, if tumor will press our superior vena cava, then edema condition can be seen. Next we have dysphagia. Okay, dysphagia means there will be difficulty in swallowing the food. Okay, if tumor press our esophagus, okay, if tumor is in the center of our chest and it have pressed our esophagus, then there will be difficulty in the swallowing of food, that is called as dysphagia. There can be jaundice can be seen in the patient, means there can be yellowishness of eyes and skin. Why there is yellowiness in the eyes and skin? Because the cancer have spread to our liver also, that's why. Next we have diagnosis of lung cancer. So what are the diagnostic evaluation of lung cancer? So first we have history and physical examination. In history we will collect all the past as well as the present history of the patient. Okay, here you can ask several questions to the patient like, is anyone in his family having a lung cancer in the past? Or what is the occupation of the patient? Okay, is patient work in any asbestos, radon or any chemical industry or not? Or patient is having any smoking habit or any tobacco having? Okay, so all the past and present history is collected here. Next we have physical examination. So a complete head to toe examination is done here, where you can also observe the patient like, is there any face swelling, okay, due to the superior vena cava tumor. Okay, and next you can also check for any lymph node swelling or not, and you can also check the cyanosis condition the patient, what is the sign and symptoms the patient is observing in himself, and is there patient have any weight loss condition or not. Okay, so all the examination, all the history past and present and all the head to toe examination is done here. Next we have chest x-ray. So chest x-ray is the first line diagnosis of lung cancer. Okay, so in chest x-ray we can see the nodules or any mass lesions in the x-ray. Okay, but it is not the confirmation test of lung cancer. Okay, so it is only a first line diagnosis for lung cancer, where you can see the nodules and any lesions in the chest. Next we have CT scan, that is computerized tomography test. Okay, it is a gold standard test for lung cancer. So through computerized tomography test, we can get the clear images of lung cancer, okay. And you can also see the size, what is the size of tumor, what is the shape of tumor, is there any lymph node is involved or not. Next we have MRI scan, that is magnetic resonance imaging. If the lung cancer have metastasized to the brain also, then we will do the magnetic resonance imaging test. A high magnetic waves are here, through which we will collect the pictures of the lung here, okay, or any other body part. Next we have positron emission tomography, that is PET scan. So in a PET scan, a radioactive substance known as GDR, okay, that is glucose deoxy radioactive substance, okay. So a glucose substance is injected into the patient body, which is a radioactive substance, okay. And we know that cancer cells are they do high metabolic activity, okay. So when we will inject the GDR into the patient body through the intravenous route or through the oral route, then the cancer cell will absorb this GDR in a high form, okay, because they do high metabolic activity, they have a high metabolism rate. And through PET scan we can observe that at which area, at which position the cancer cells are present in the patient body. Next we have CBC. CBC means a complete blood count. Here we are checking the condition of anemia in the patient, okay, and the increased level of WBC. Whenever WBC get increased in a body, it means there is any inflammation or any infection is present into the patient body. And we can also check for the platelet count here, okay. So all the biochemistry tests you have to do here. Next we have liver and kidney function test. Is lung cancer have metastasized to the liver area, okay, and is the lung cancer had metastasized to our kidney area? So we will check the healthy condition of liver and kidney here. Next we have biopsy. So in a biopsy, a tissue sample is collected here, okay, and this biopsy is a gold standard and it is a confirmation test for the lung cancer, okay. This is a confirmation test for the lung cancer. So a tissue sample is collected here, okay, a mass of cancer cell is collected here, and it is sent to the lab for the investigation that it is a cancerous cell or not. And now we can do biopsy in a numerical way, like we have bronchoscopy with biopsy. Through a bronchoscope means a flexible guide wire is injected into the bronchi area of the patient, and through that tube which have camera attached in it, through that tube we can collect the tissue sample, that is bronchoscopy guided biopsy. Next we have CT guided needle biopsy. Through the CT scan or through the computerized tomography scan, we are collecting the tissue or mass or a cancer cell here. Next we have sputum culture. So sputum, which sputum we will take here? We will take the early morning sputum here, okay. The deep cough which the patient do in the morning time, that the expectorant of the cough which he do in the morning time, that sputum we will collect here, okay. And if there are any abnormal cells or any other cells are present in the sputum, okay, is there any other infection is present in the sputum of patient, so we will do the sputum culture. Next we have thoracosynthesis. So thoracosynthesis is a procedure which is done through a needle, okay. So in thoracosynthesis, we will collect the pleural fluid of the patient, because sometimes the lung cancer can metastasize to the pleural area of our lungs also, okay, and it can form a pleural effusion type of cancer there. So we will collect the pleural fluid for the lung cancer here. Next we have pulmonary function test. So before doing any surgery of the patient for lung cancer, we will check the healthy condition of lung here, okay, that is the patient lungs are in healthy condition or not, okay, what is the intake and output of the lungs and what is the residual volume of the lungs here. So we will check the healthy condition of lung here. Next we have surgery, that is diagnosis, that is medistinoscopy, okay. So what is medistinoscopy? Means scopy, a diagnosis procedure through which we are observing the center. Medino means middle area, okay. So we are scoping, we are diagnosing the middle area of the chest here, okay. Is the tumor is present in the middle bronchus and in the center nodules, okay. So we'll do the medistinoscopy here. Next we have VATS. VATS means video assisted thoracoscopy surgery. If the biopsy sample is not collected through these method, then we will go for VETs. Through the videography, we will collect the tissue, mass or cancer cell from the chest of the patient here. Next, we have management of lung cancer, or what are the treatment options for the lung cancer. Okay, so first we have chemotherapy. So chemo are the drugs or the medicines which are given to the patient through the oral route or by the intravenous route. Okay, so these are the cancer killing drugs. Okay, so these drugs will kill the cancer or they will shrink the tumor. Okay, so this chemotherapy drug can be given with the radiation, immuno and with the surgery also. Okay, so it can be given before surgery and after the surgery also. Okay, so we have drugs which kill the or slow the growth of rapidly dividing cancerous cell. So these are the medicine which will stop the cancer cell growth and they will stop the rapidly dividing cancer cell. Okay, so in non-small cell lung cancer, so we have two types of lung cancer. So in non-small cell lung cancer, we give two drug regimen. Okay, so here we are giving two drugs to the patient. Suppose we can give cis with Taxol, okay, cis with Taxotere and cis with gemcitabine. Again, we can also give carboplatin with Taxol, carboplatin with this Taxotere and carboplatin with gemcitabine. Okay, so this is a two drug regimen. Next, for small cell lung cancer, we have drugs like cisplatin and etoposide. So this is a combination drug. Okay, so chemo have several side effects in the patient body, like patient can have low level of RBC, it will also decrease platelets or WBC count in the patient body. Patient can go through alopecia condition, it means there is a hair loss condition in the patient, and he can also have nausea and vomiting feeling. Okay, because this chemotherapy drugs work in cancer cell also, and they will target our healthy or normal cells also. Okay, so these are the systemic drugs. Okay, these drugs will work in our whole body. Okay, so they are destroying the cancer cell or as well as the healthy cell of our body, so it has certain side effects. Next, we have radiation therapy. Radiation means the rays are given to the patient. Okay, so these are the high energy rays. So these rays can be in any form, like we have X-rays, like we have gamma rays, like we have protons. Okay, so these high energy rays will kill the cancer cell. Okay, so there are two types of radiation therapy, like we have external radiation, a beam of external light is given into the patient body. Okay, in this external radiation patient have no pain, and we have internal radiation also. Internal means the pills. Okay, the oral medicines are given to the patient and these medicine will destroy or kill the cancer cell here. Okay, so these are the certain rays. Next, we have immunotherapy. The name is suggesting immuno. It means these are the medicine which will build our immunity. Okay, they will boost our immune cells like T cells. Okay, so this therapy helps the body immune system to recognize the cancer cell and to attack the cancer cell. It means this immune therapy is boosting our body's natural defense mechanism. Okay, so it is boosting our immune cells and our own body immune cell will fight with the cancer cell. Okay, so again this immune therapy can be given with the radiation as well as with the chemotherapy also. Now let's come to the surgical treatment. Surgical means through the incision or through the operation we are removing the cancerous part from the lungs. So we have certain types of surgery. So first we discuss lobectomy. The name is suggesting lobe, means it is removing a single lobe of the lung here. So we know that in right side of lung we have 3 lobes. Okay, and in left we have 2 lobes only. So lobectomy, lobic means it is removing a single lobe. Suppose the cancer cells are present in the upper lobe. Okay, and cancer have diffused in the upper lobe. Okay, so now in lobectomy we are removing a single lobe of the lung here. Okay, so I have removed a upper lobe from here, so any lobe can be removed here. Next we have bilobectomy. Bi, as the name is indicating, bi, it means the 2 lobes of the lung is removed here. Basically the bilobectomy is done for the right lung only. Okay, suppose we have 3 lobe here and the cancer cells or tumor is present in the upper as well as in the middle lobe. So here in bilobectomy of the right lung we are removing the 2 lobes. Okay, this one and this one have been removed here. Only the middle one is left here. Okay, so it is called as bile lobectomy, and it is basically done for the right lung only. Next we have sleeve resection. So here the cancerous lobe as well as the main bronchus part is removed. Okay, here one lobe is removed and the main bronchus half part is removed where the cancer is present. So this is the main esophagus, trachea, windpipe. This is the trachea. Next we have bronchus. Okay, so half part of the main bronchus is removed and one lobe of the lung is removed here. One lobe and half main bronchus is removed here, and the remaining bronchus is attached with the lung. Okay, so you understood what is sleeve resection. Sleeve means one lobe and half of the main bronchus is removed, and the remaining bronchus, the healthy bronchus, is attached with the lung here. Segmentectomy. Segment means a particular segment is removed from the lobe. In this, the complete lobe have been not removed. Only a certain portion or certain segment is removed here. Suppose in this lobe, a segment is having a cancer cell present. Okay, so here we will remove a certain segment only. Okay, next we have wedge resection, means a small pie-shaped area is removed. Only a small portion of the lung is removed here where the cancer cell are present. Basically a triangular or a pie-shaped area, means a small area is removed here. So these were the management of lung cancer. Thank you.